I'm delighted to introduce GE Healthcare, both Azar Alizadeh and partner in crime Andrew in the background. Um, there he was. Um, I assume, Andrew, you're also a principal scientist?
I'm actually a senior scientist here, but
Okay. So Andrew is the senior scientist, Azar is the principal scientist, and they will tell us about, well, I have a different presentation title written down, so I take yours. Human Health and Performance Monitoring Systems, Flexible Hybrid Electronics Manufacturing. Azar, the stage is yours.
Thank you so much, and pleasure with you guys to be here today. I'm just going to give a very broad overview of the work that we have been doing on continuous physiological and biochemical monitoring. And this is a platform that Andrew and I, with a very large group of people, actually at GE Research, as well as collaborators across several universities and companies in the US, have been leading and carrying on for close to a decade. The idea here is familiar to everyone, to this audience, right? That's about making wireless, basically smart patches that can either measure your physiological parameters, that's what is shown on the top. Those are could be the type of parameters such as vital signs that many of us are familiar with, as well as more maybe less common fluidic-based biomarker parameters. That's the patch that is shown on the arm, with which that you can measure in an in situ and continuous manner, biomarkers of interest. And the interesting thing is that there's a lot of work that is going on in this space, and our group actually focuses the development of these patches very much in the context of specific applications. And we have covered across GE the entire gamut of performance that is elite, from elite athletes to military applications, which is actually one of the main focus areas of Andrew and I. Other team members have done occupational, and Andrew and I actually also work in towards developing these patches for clinical applications and settings. The ultimate goal that we are pursuing is not only the development of the patches and extraction of the signals in a wireless manner, but to be able to assess and basically diagnose a given status and being able to act on it. So our goal at the end of the day is to really develop algorithms that once the data comes up, we want to understand what it means and what you can do with that information. What I'm going to be talking to you about today is really focusing, and is a very broad overview, focusing on the manufacturing aspect of this work. But both Andrew and I, with another colleague, Matt Meisner, who is the third partner in crime, we have offered to TechPlick team that we would, if you are interested, we could go in a deep dive and just try to explain to you any of these areas in much more detail. Today is just a very broad overview. Continuous physiological monitoring, everyone is aware of how much is going on in this space. The area of physiological vital signs is pretty much like, actually, you may argue that starting to become commodities. There are a lot of these devices that, at least for performance applications, that you could purchase them on Amazon. And many of these devices actually in clinical settings are just becoming rather routine. They are measuring many of these parameters with the fidelity of the wired conventional versions. However, as we transition to a patch format, there are basically questions that the field is still pursuing: robust skin device interfaces, extended time use, and power and communications. The batteries are still a challenge when you want to do very high